Thyroid Talks, Unraveling the Mysteries of Hypothyroidism and Levothyroxine. Welcome to Thyroid Talks, the show where we dive deep into the often misunderstood world of thyroid health. I'm your host, Tom Jones, Pharmacist Live, and today we're unlocking the secrets of hypothyroidism and its most common ally, levothyroxine. Whether you're a newly diagnosed patient, a long term thyroid warrior, or just curious about thyroid health, this episode is for you. Let's embark on this enlightening journey together. Hypothyroidism, a condition marked by an underactive thyroid gland, affects millions worldwide, silently altering lives with its myriad of symptoms. In the heart of its management is levothyroxine, a synthetic hormone that promises to restore balance and vitality to those it touches. And this presentation explores the transformative journey of an individual finding renewed hope through this vital medication. Let's dive in. Understanding hypothyroidism. And the topic overview is to kick things off with exploring what hypothyroidism actually is. Now, here's something I want you to imagine your body as a complex city and the thyroid hormone as the electricity that keeps it running. Hypothyroidism essentially is when the city's power supply goes out. To begin our deeper understanding, let's dive into the essence of hypothyroidism, a condition that, while common, is often shrouded in mystery and misconceptions. Hypothyroidism emerges when the thyroid gland, a butterfly shaped organ nestled in the neck, your base of the neck, it doesn't produce enough thyroid hormone to meet the body's needs. And this hormone, vital for regulating metabolism, energy generation, and overall bodily functions, is the silent conductor of our bodily orchestra, ensuring that everything from our heartbeat to our body temperature operates in harmony. The causes of hypothyroidism are as varied as they are complex, ranging from autoimmune diseases such as Hashimoto's thyroiditis, where the body's immune system mistakenly attacks the thyroid, to the aftermath of medical treatments or surgery that affects thyroid function. Even iodine deficiency, though less common in parts of the world where iodized salt is used, can lead to this condition. People living with hypothyroidism often describe it as wading through life in a hidden handbrake engaged. That engagement, the symptoms are pernicious and often creeping up so slowly that they've mistaken for the mere toll of aging or stress. Includes profound fatigue, unexplained weight gain, it goes up, dry skin, hair loss, sensitivity to cold, and a slow heart rate, among other items. These symptoms not only affect physical well being, but cast a long shadow over mental health, with depression and memory issues frequently linked to the condition. So, diagnosing hypothyroidism involves a delicate dance of clinical evaluation and laboratory tests, most noticeably the measurement of thyroid stimulating hormone, that's TSH, and if necessary, thyroxine, T4, those levels in the blood. A high level of TSH and a low level of T4 typically points towards hypothyroidism, guiding the way towards treatment. The journey, though hypothyroidism, is not really easy. It's challenging. It's not without hope, though. Understanding this condition is the first step towards demystifying it, opening the door to an effective management and a return to the symphony of life as it was meant to be experienced. As we peel back those layers of hypothyroidism, let's remember the resilience of those who navigate this condition, often with grace and courage that inspires us all. So now let's turn to the focus of often misunderstood realm of hypothyroidism symptoms. And we find a landscape rich in clues that, when pieced together, illuminate the reality of living with this condition. The symptoms of hypothyroidism weave through the daily lives of affected individuals like unwelcome threads, subsequently altering the fabric of these people's well-being. Fatigue stands as one of the primary heralds of hypothyroidism, the kind of exhaustion that evaporates individuals, seeping into their bones and clouding their days. There isn't a typical tiredness alleviated by a good night's sleep. It's a profound, relentless fatigue that persists regardless of rest, profoundly impacting the ability of them to work and their productivity and the enjoyment of daily activities. And then there's weight gain. It follows closely with a baffling and frustrating symptom for many, and these people, despite maintaining or even intensifying their usual diet and their exercise routines, the individuals with hypothyroidism often find the scales tipping in an unwelcome direction, going up. This can lead to a cascade of emotional and physical challenges as the weight gain seems disconnected with their lifestyle choices. And then there's cold sensitivity. That's another hallmark. It creates an internal chill that no amount of layers or warm drinks can navigate and mitigate. These affected people may find themselves reaching for sweaters and blankets, even in settings that others find comfortably warm, a testament to the thyroid hormone's role in regulating the body temperature. Beyond these, the symptoms of hypothyroidism cast a wide net, ensuring various aspects of health and daily life. Dry skin, hair loss, muscle weakness, slowed heart rate, and menstrual changes are but a few of the myriad of symptoms that individuals may face. Mental health is not spared, with depression and memory issues often walking hand in hand with the physical manifestations of the condition. The insidious nature of these symptoms lies in their commonality with other conditions and the stresses of everyday life, making hypothyroidism a master of disguise. It is this very commonality that often delays diagnosis and treatment, as individuals and even healthcare professionals attribute symptoms to other causes. In shining a spotlight on these symptoms, the aim is to not only inform, but to empower. Knowledge is the first step towards recognition, leading a timely diagnosis and treatment. Understanding the multifaceted nature of hypothyroidism symptoms opens the door to empathy, support, and a proactive approach to managing this pervasive condition. So, let's look at the symptoms. Dive into the common symptoms: fatigue, weight gain, cold sensitivity, and more. And now we're going to talk about a real life patient story. It's one of millions, and that's sad. A brief narrative about someone living with hypothyroidism, highlighting personal experiences with symptoms and the path to the diagnostic part of it. The mosaic of stories that illustrate and illuminate the daily realities of hypothyroidism. There's Anna, and her narrative shines a light on the often convoluted path to diagnosis and the resilience required to navigate this journey. A young professional, Anna is an avid hiker, and her life is full of vibrant and vigor until the day it wasn't. Holy moly! It began suddenly with a fatigue that no amount of sleep could shake. At first, Anna attributed this to her busy schedule, but as weeks turned into months, the exhaustion became an unyielding shadow, draining the color from her days. Alongside the fatigue, Anna noted other peculiarities. Despite her active lifestyle and mindful eating, the numbers on the scale, crept upward, and her once clear skin became inexplicably dry and itchy. Anna's love for hiking and the outdoors, which was always provided solace and rejuvenation, now felt like insurmountable task. The cold that she once found refreshing on the trail seemed to penetrate deeper into her bones, making even mild temperatures feel unbearably cold, chilly, and awful. Despite these mounting challenges, the most troubling symptom for Anna was the fog that developed in her mind. It seemed to envelop her whole body all at once. Tasks that once became easy to her now felt like navigating through a quagmire with memory lapses and overarching senses of depression becoming constant companions. Oh my goodness. Seeking answers, Anna visited countless specialists, each attempting to piece together the puzzle with various tests and evaluations. The breakthrough came when a new endocrinologist, listening intently to Anna's story, suggested testing her for thyroid levels. It was revolutionary. Anna's TSA levels were significantly higher, elevated up in the sky, pointing towards hypothyroidism. It was a label for her struggles, but more importantly, is a path forward. The prescription for levothyroxine felt like a beacon of hope. Within weeks of starting the medication, the fog began to lift, both literally and metaphorically. The relentless fatigue eased, allowing Anna to reclaim her energy and zest for life. Her weight stabilized, and the cold that once felt bone deep became manageable. Perhaps more precious to Anna was the return of her mental clarity, allowing her to engage with her work and passions fully once again. Anna's story, marked by unestimated symptoms and a tireless quest for answers, mirrors the experiences of many living with hypothyroidism. It serves as a testimony to the importance of listening to one's body and advocating to one's health. In sharing her journey, Anna hopes to illuminate the path for others, highlighting that while the road to diagnosis can be fraught with challenges, there's hope, there's healing on the other side. So, meet levothyroxine, thyroid's best friend. In the narrative of managing and mitigating the effects of hypothyroidism, levothyroxine emerges as a protagonist, a beacon of hope for those grappling with this condition. Finally dubbed by many as thyroid's best friend, levothyroxine is not merely a medication, but a lifeline that restores balance to a body thrown off course by an underactive thyroid. Now, what is levothyroxine? Levothyroxine is a synthetic form of thyroxine, T4, the primary hormone produced by the thyroid gland. In the intricate ballet of the body's endocrine system, thyroxine plays a critical role, influencing metabolism, energy generation, and the overall function of practically every organ in the body. In individuals with hypothyroidism, though, where the thyroid fails to produce significant amounts of this essential hormone, levothyroxine steps in and fills that void, mimicking the natural hormone's effect. Administered orally, the journey of levothyroxine from a daily pill to a harbinger of normalcy is marked by its absorption in the gastrointestinal tract, from where it makes its way into the bloodstream. Once there, it behaves indistinguishably from the body's own thyroxine, discreetly steering the metabolic processes back into the right track, on the right road, reviving energy levels, aiding in the stabilization of weight, and alleviating the myriad of other symptoms that hypothyroidism brings to the forefront. The precision in which levothyroxine must be dosed mirrors the delicate balance it seeks to restore. Finding the right dosage is often a dance, adjusting and tweaking and getting based on regular monitoring of thyroid hormone levels and patient feedback. The goal is to mimic natural thyroid hormone function as closely as possible, ensuring that the individual can lead a life encumbered by the shadows of hypothyroidism. As much as levothyroxine is a celebration of medical science's ability to mimic and restore natural balance, it's also a testament to the resilience of those who live with hypothyroidism. It represents the convergence of knowledge, patience, and hope. Yes, hope. A triad that underpins the journey towards wellness. For many, levothyroxine is more than medication. It's the renewal of promise, an emblem of the return to self, and the ever-present ally in the pursuit of health. Thus, in the pantheon of treatments available to modern medicine, levothyroxine holds a special place, especially in the hearts of those it helps. It stands as a reminder of the journey from diagnosis to management, a path marked by understanding, adjustments, and the unwavering hope for a life lived in balance. So, it's akin to a generator. Yes, it's stepping in when the thyroid can't produce enough hormone on its own. It's the most prescribed medication for hypothyroidism and for many a daily part of life. And how does it work? An easy to understand explanation of the levothyroxine role in the body. Now, here's the dosage debrief, discussing the importance of finding the right dosage and the journey that it entails. Finding that correct dosage of levothyroxine is akin to tuning a musical instrument. Just as slightly off-tune instrument can affect the harmony of an entire orchestra. The incorrect dosage of levothyroxine can disrupt the delicate balance of the body's functioning. This process of fine-tuning the dosage is critical because too little will leave the hypothyroid symptoms unaddressed, while too much can catapult the body into symptoms of hyperthyroidism, such as increased heart rate, anxiety, and weight loss. Thus, embarking on that journey to find the right dosage of levothyroxine is both an art and a science, demanding patience and precision. The initiation of levothyroxine therapy often starts with an estimation based on the body's weight, age, and severity of hormone deficiency, among other factors. However, the body's response to the medication may vary widely among individuals, influenced by factors such as absorption rates, the presence of other health conditions, and even the concurrent use of certain foods and other medications that might interfere with levothyroxine. Hence, the starting dosage is exactly that, a starting point. After beginning levothyroxine therapy, patients typically undergo a series of blood tests, spaced weeks or months apart, to monitor the thyroid hormone levels. These tests, focusing primarily on thyroid stimulating hormone, TSH, and sometimes T4 levels, serve as guideposts on the journey to finding the optimal dosage. Elevated TSH levels might indicate the need for a higher dose of levothyroxine, while lower doses and levels will actually be when the levels of TSH are lower. The current dosage, if you get a lower level of TSH, it can suggest that the current dosage is too high. Beyond lab values, the patient's feedback on how they're feeling plays a critical role in the adjustment process. The ultimate goal of levothyroxine therapy is not just normalize thyroid hormone levels, but to alleviate symptoms and restore the quality of life. Therefore, open communication between the patient and the healthcare provider is essential, with the patient's subjective experiences and symptoms being key to that fine-tuning the medication of the dosage. It's not uncommon for the journey to the right levothyroxine dosage to take several different situations over several months. During that time, patients may experience shifts in their symptoms as the body adjusts to each new dosage level. This underscores the importance of patience and perseverance for both patients and healthcare providers. Finally, once the optimal dosage is found, it doesn't mean the journey is over. No, regular monitoring is still necessary, as factors such as aging, weight changes, and other health developments can affect thyroid hormone needs over time. The dosage of levothyroxine may need adjustments throughout the patient's life. In sum, the path to finding the right levothyroxine dosage is a personalized journey requiring careful navigation, regular monitoring, and a collaborative approach between the patient and their health care provider team. It's a journey towards harmony, one where the symphony of the body's functions plays beautifully in tune. Now, let's live with levothyroxine. The morning rituals. The best practice for taking levothyroxine is on an empty stomach, and why consistency matters the most. It involves integrating the medication into one's daily routine, often marking the start of each day with a practice that ensures its optimal efficiency. For many, this begins in the quiet of the morning, setting the stage for the medication's seamless incorporation into their lives. One of the cardinal rules of taking levothyroxine is its consumption on an empty stomach, ideally first thing in the morning. The reason behind this guidance is rooted in maximizing the body's absorption of the medication. Food will interfere with levothyroxine's absorption, reducing its effectiveness and leading to fluctuating levels of thyroid hormone in the bloodstream. Therefore, it is recommended to take levothyroxine with a full glass of water at least 30 to 60 minutes before eating breakfast. This allows the medication to move through the stomach and into the intestines, where it's absorbed more efficiently and effectively, ensuring that the body receives the full dose. Why does consistency matter? Just as crucial as the method of taking levothyroxine is the consistency with which it is taken. The thyroid hormone levels in the body need to be kept steady to absorb and avoid the symptoms of either hypothyroidism or even hyperthyroidism, and to keep the body's processes running smoothly. By taking levothyroxine at the same time each day, you help maintain a stable level of thyroid hormone in your body, which is crucial for its proper functioning. Moreover, consistency aids in establishment of a routine, reducing the chances of missing a dose. Skipping doses or inconsistent timing can lead to fluctuations in the hormone levels, potentially bringing back the unpleasant symptom of hypothyroidism. It's not just about the time of day either. It's even the brand of levothyroxine, if switched, can affect how the body absorbs and utilizes the medication, emphasizing the importance of consistency across all aspects of treatment. For those new to levothyroxine, integrating it into this morning routine can take some adjustment. It might mean setting an alarm a bit earlier to take the medication before breakfast, or adjusting morning habits to ensure that 30 to 60-minute window before eating is maintained. However, with time, this practice becomes a habit. And it's just like brushing one's teeth, an integral part, that most unremarkable part of the morning. Adhering to these practices for taking levothyroxine not only optimizes its effectiveness, but also fosters a sense of control and predictability in maintaining hypothyroidism. Over time, the ritual becomes a part of the individual's identity, a testament to their resilience and commitment to maintaining their health. In conclusion, living with levothyroxine is about much more than just simply taking a pill. It's about establishing a ritual rooted in consistency and in best practices. This ritual ensures that individuals can lead a balanced life despite the underlying situations that actually occur with this medication, with the morning serving as a daily reminder of their ongoing commitment to health and to well-being. Now, let's talk about the side effects and solutions. As a pharmacist, I like to go over these really, really carefully and really, really well, covering potential side effects and tips of managing them. Food, drug, and nutrient interactions, highlighting key interactions that patients should be aware of. Living with levothyroxine indeed involves navigating the potential side effects and being aware of those food, drug, and nutrient interactions. You have to understand these aspects, and it's critical in helping the patient manage hypothyroidism. So, the side effects and solutions. It's a lifetime commitment. It can come with side effects, particularly if the dose is not quite right. Common side effects may include symptoms of hyperthyroidism, such as rapid heart rate, tachycardia, increased appetite, anxiety, tremors, and insomnia due to an excess of thyroid hormone. Other side effects may be less intuitive, like hair loss, which can be particularly distressing. This effect is usually temporary, but the body adjusts to the medication, but it's important for patients to know that it can occur. Dosage requirements. Fine-tuning that dosage of levothyroxine is often the first step in managing side effects. Regular monitoring of the thyroid hormone levels can lead to ensure the dosage is optimal, reducing the risk of unwanted effects. Timing and method of administration. Always, always, always Levothyroxine on an empty stomach at the same time every day can help avoid those fluctuations in thyroid hormone levels that can exacerbate side effects. Symptomatic treatments. For side effects such as anxiety and tremors, additional treatments may be considered in collaboration with healthcare providers. So inform the patient always. If you're the patient, there's potential for side effects and strategies to manage them. And knowledge empowers patients to seek help and sooner than rather later. Food, drug, and nutrient interactions. It can be influenced by certain foods, drugs, and nutrients, make it imperative for patients to understand these interactions. Calcium and iron supplements, they interfere with levothyroxine's absorption. It's recommended to take levothyroxine at least 4 hours before or after these supplements. Soy products. Soy may affect the body's ability to absorb thyroid medication. Patients need to avoid soy altogether, but should maintain consistency in their soy intake and monitor thyroid levels accordingly. Grapefruit juice can increase the blood levels of levothyroxine, potentially leading to side effects. A safe approach is to consume grapefruit and its juice several hours apart from the medication. Other medications, certain drugs, including proton pump inhibitors, some anticonvulsants, and estrogen containing products can interfere with levothyroxine. A comprehensive medical review is essential to avoid interactions. Tips to maintain interactions. We need to always have medication reviews regularly with the pharmacist, regularly talk to the doctor and the pharmacist, and go over all medications, including over-the-counter drugs, supplements, with a healthcare provider or pharmacist, and they can identify the potential interactions. And consistency in diet. Maintain a consistent diet to help mitigate the effects of food interactions on levothyroxine absorption. Always ask about a written guidance on how to take levothyroxine, what foods or supplements to avoid and consume consistently. And the importance of regular medication review is key. Pharmacists play that role. It's a vital role in guiding patients through the complexities of living with levothyroxine by addressing side effects proactively and educating patients about potential interactions. Pharmacists can significantly impact patients' quality of life and treatment with success. So, the best practice with taking levothyroxine again is on an empty stomach and first thing in the morning. And the consistency matters all so much. Covering potential side effects and tips and interactions with food, drug, and nutrient. Now, I've got some questions that we have actually gotten since we've been on the air, and these will be, we'll try to go over those as we wrap this up. We'll dig into the inbox right now. Can lifestyle changes improve my hypothyroidism to the point of not needing medication? The response to that is while lifestyle changes, such as a balanced diet and regular exercise, are critical for overall well-being and can positively impact the thyroid health, they cannot replace levothyroxine or any other drug for hypothyroidism. Your drug is essential for replenishing the deficiency of thyroid hormone and maintaining body functions. But you need to talk to your healthcare provider, and such adjustments can enhance medication effectiveness and improve quality of life. That's a question that you talk to your healthcare provider, your doctor, your physician assistant, your nurse practitioner. Does levothyroxine mean I can enjoy my morning coffee? Hey, you can still enjoy your coffee. However, it's recommended to wait at least 30 minutes after taking levothyroxine before having coffee. The goal is to allow the medication ample time to be absorbed without interference, as caffeine can affect the absorption rate. And here's a couple of tips from the thyroid warriors. Tip number one, I prepare my levothyroxine tablet and a glass of water beside my bed each night. That way I take it first thing in the morning and there's no distraction. Here's a second tip. Keeping a symptom journal helped me communicate more effectively with my doctor, making it easier to adjust my dosage accurately. Hey, that's a great tip. Keep a journal, write it down. It's imperative that you do that. Tip three, I set a recurring alarm on my phone as a reminder to take my medication at the same time every day. Yes, consistency is the key. And as we wrap up today's enriching conversation, it's clear that while the path to hypothyroidism and levothyroxine might seem really a tremendous challenge, arming yourself with knowledge and surrounding yourself with a supportive community can illuminate the journey towards not just better health, but thriving health. And if today's episode resonated with you, sparked curiosity, or provoked questions and answers that you need answering, we urge you to share it within your circle. Leave us a message. Thrive for hypothyroidism. Thriving for that right dosage is not an individual fight. It's about creating waves of awareness and building a community that uplifts each one of you. So, sharing practical advice and life hacks from the community on managing life with hypothyroidism and optimizing levothyroxine is important. It's effective. It works. Thank you for lending your ear for Thyroid Talks. It's been a pleasure to dive deep into these topics, answer your questions, and share tips with those navigating similar journeys. Anna gave us a great example of how you can succeed with hypothyroidism. Stay empowered, stay informed, and join us again for episode number 2 coming up soon. Leave us your information and we'll let you know when that comes up. Remember, your thyroid journey is uniquely you, but you're not alone. We're here to explore it hand in hand. Take care, thrive, and until next time, keep asking those questions, keep seeking answers, and keep supporting one another. Bye for now.